Hi, Laura. My name is Shelby. Can I follow you around today?
Absolutely, Shelby.
All right. Can I get the S-bar for this patient?
Sure. We have Mr. Light. He is a 67-year-old male who weighs 171 pounds. He's full coat and has no allergies. He is here today because he's had an increased blood sugar over the last 5 days. He has his previous A1C was 5.2. Now it is 6.5 as of 1600 today. Everything else is regular with the exception of a pressure ulcer on his right heel. It measures 5 by 5 by 2.5 centimeters. It's 3 centimeters deep into the dermis with a pink wound base. There's no tunneling or undermining. There is some moderate serosanguinous fluid noted. He has increased pain, but the morphine seems to be helping. He has tried soaking his heel, but it has in salt water, but it has no relief. He currently takes simvastatin, gabapentin, Humulin, and Lispro to control his blood sugars. He is due for his next he is due for his shot of Lispro. We just checked his blood sugar and it is 290. So according to his sliding scale, because it's between 251 and 300, we're going to give 6 units. His meal tray is on the way because we want to make sure we administer it within 15 minutes of eating.
Okay. So why specifically is the client receiving this insulin right now?
He is a type 1 diabetic.
Okay. And what action does the medication have on the body?
Oh, that's a good question. It decreases hepatic glucose production.
Okay. And then when should you question administering the medicine?
If his blood sugar is under 70 or it is under doctor's orders, if it is over 300, to call the physician.
Okay. And does the medication have a therapeutic serum level? Does that apply for this medicine?
Not necessarily, no, not for this one. You just want to make sure that the glucose stays within his normal range, 70 to 120.
Okay. And then what vital signs are we going to monitor with this medicine?
You're going to make sure that you check the blood glucose. Keep an eye on that because this is a sliding scale, so you administer particular units according to the glucose at the time.
Okay, and then what physiological parameters should we monitor when the medication is being administered?
You want to make sure that you check for signs and symptoms of hypoglycemia, cool, pale, diaphoretic, change in mental status.
Okay, and then what interventions do we have to teach the client to ensure the medication is administered safely in the hospital and then also when he goes home?
You want to make sure that you instruct the patient to rotate sites so that you don't get complications from using the same site over and over again. You want to make sure that they understand proper insulin storage. You want to make sure that they inspect the insulin to make sure there's no particles, it's clear, it's within the expiration date. You also want to inform them of proper syringe handling and sharps and safety.
Okay, and then what are the side effects of and potential adverse reactions?
You can get anaphylaxis from this medication, but it's rare. The main side effect from this is hypoglycemia. So you want to make sure that the patient eats within 15 minutes of taking this particular medication.
Okay, and then how do we know the medication is effective?
The patient's blood sugar will stay within a therapeutic range, 70 to 120.
Okay, that sounds good.
Are you ready to go give the medication?
Yes.
Okay. Okay. Hi, Mr. Light. I'm Laura. I'll be your nurse for today.
Hi,
this
Laura.
is Shelby. She's my student nurse as well. She's just going to come with us. How you feeling today?
I guess I'm not right. Food here sucks.
I hear that happens in the hospital. Can you tell me your first and last name and your date of birth, please?
I'm Glenn Light, and I'm 67 years old.
Perfect. Do you have any allergies?
Nope.
Okay. So we're going to go ahead and give you your shot of insulin. Your food tray is on its way, so it should be here any moment now. So wash my hands and put on some gloves. I'm going to check the order. You have Lispro coming. It is 6 units because of your blood sugar being 290. Maybe I'll get gloves on. Okay. Okay, just need to go ahead and scan your bracelet, please. Thank you. And then I'm going to check my medication against my MAR, and it is correct. I want to check the expiration date, make sure it's not expired. I want to check the insulin, make sure it's clear, there's no particulates in it. I need to scan my medication. Maybe. Okay. Oh, I put it in the wrong one. Hang on. I just need to scan your barcode again. I scanned the medication instead of your name. Here we go.
Well, you can call me Lisbon.
Yeah, you like that name? Give you a
Close
new
to
name?
light.
New name, new year?
Yeah.
Okay, so you want to wipe the top of the medication with an alcohol swipe, clean it like you mean it. You're going to inject 6 units of air. There we go. What are you getting for dinner today? Anything exciting?
Hospital food. It all sucks.
I saw that you requested some information on diet,
Yeah. I
on a
want
low
salt.
sodium,
I want
sodium
salt.
diet.
Salt's good.
Well, you kind of need to restrict your sodium a little bit. I wasn't supposed to do that. Do you have a preferred site for doing your shots?
Yeah, right here in my tummy.
In
It's
your
got the most
abdomen?
fat.
Okay, it's got the most fat. We're gonna go ahead and do a little bit of 2 inches away from your umbilicus. We're gonna clean the site in a circular motion. There we go. We're gonna go in at a 90-degree angle. Just put it in, and there we go. Hold it for a couple seconds, and then we're good. Sharp container. Okay, so we're gonna do soda. You want it on a low sodium diet? Are you aware of foods that are high in sodium?
Yeah. All the good stuff.
All the good stuff like what?
Like soda and potato chips and fried chicken and pizza. And
Sure, but sodium's also hidden in some other areas like canned foods and frozen foods, frozen dinners especially. So you just want to make sure that you flip the labels over and check those labels to ensure that you stay under 2,000 milligrams per day. Then I have some other information for you here on a diet as well.
Okay.
And then do you have any other questions or anything for me?
No, I think that's it.
How are you feeling after that shot?
No, I'm all right.
Pretty good?
Yep.
Okay. Alrighty. And then we are all done. Ooh, I can't go too far. I'll unplug myself. Do you have any other questions for me, Shelby?
Yeah, were there any pertinent pieces of information you reviewed before administering the client the medication, maybe that I didn't hear or see?
What was the question again? I'm sorry. I'm documenting at the same time. I'm sorry.
Were there any pertinent pieces of information you received before administering the client the medication?
This particular medication, you want to make sure, because again, it's on a sliding scale, so you want to make sure that you check the blood sugar just prior to giving the medication, because blood sugars can fluctuate. You don't want to accidentally give too many units or under units.
Okay, did this information affect your decision to administer the medication?
Well, yes, because again, they're on a sliding scale, so you have to adjust according to whatever the blood sugar is at that time.
Okay, and then did this information affect how you administer the medication?
No, insulin is administered sub-Q regardless of whatever the blood sugar is.
Okay, well, I think that's all I have for now. I'll let you document in peace.
Thank you. Have a good day.